Providing patient care for the unconscious population in the ICU can be very challenging, and over time, some nurses can begin to face barriers to providing caring behaviors. The attitude of a nurse, the working environment, and hospital technology are all examples of these barriers that prevent therapeutic nurse-patient communication. For some nurses, communication can be difficult to maintain with unconscious patients because it is a one-way process. One-sided conversations can decrease motivation for the nurse to continue to communicate with unresponsive patients.
Good morning, Mrs. Jones. My name is Yesenia. I'll be helping taking care of you today. I'm just going to make sure that you're feeling fine. I want you to let me know if you're feeling any pain. If you do, could you please squeeze my hand?
Knock, knock. Yesenia, hey, what's up? What are you doing?
Oh, just getting introduced with my patient, getting ready for the day.
You do see that she's not awake. She's unconscious. You understand that, right?
Right.
Okay, I know they probably taught you in school, you should talk to your patient. They might be able to hear you. This lady is not going to hear you. It's useless, okay? You have a lot of other tasks you need to do, and sitting here talking with someone who's not going to conversate back is not going to be helpful. So come on, just finish up, get her vitals really quick, do your assessment, and let's go. We got another patient to take care of, okay?
Okay.
All right, thanks. Oh my God, did you guys see Yesenia today? Bed 4, you know who's totally out of it, totally unresponsive? She goes in there, hi, my name's Yesenia. I'm going to be your nurse today.
Oh my gosh.
Squeeze my hand if you can hear me. I know.
She's maybe going crazy.
Yeah.
Well, I think it makes a difference in her care anyways.
Oh my gosh.
So stupid. Hi.
Oh, hey Yesenia.
Hey, I was running a little late with my patients.
Was he a talker?
I know, but I've noticed that every time I talk to my patients and just it helps them feel at ease. I can tell by their vitals, and they're just not as, they just seem a little bit more relaxed. It helps them cheer up, I believe.
You know, I'm sure that really, really helps. That's good.
When the second nurse walks into the room, she wrongly assumes that an unresponsive patient will not benefit from such interaction because they are unconscious. However, there are studies that show that some recovered patients were able to recall specific conversations that occurred during their unconscious condition, even though they weren't able to physically respond. No matter what, hearing is not entirely affected in the patient whether they are responsive or not. By explaining procedures, though, a reduction in anxiety may be indicated by a decrease in vital signs like respiratory rate and heart rate. This is why it is crucial for the nurse to continue to explain all procedures, even though the patient cannot show signs of increased awareness. One nurse's attitude towards communicating with unresponsive patients can influence other nurses to act in the same way, which then leads to depersonalized care. This can lead to an unsupportive environment and create another barrier to patient interaction. Environment can play an important role in the nurse-patient communication by causing interference, distractions, and preventing the nurse from providing holistic care.
Okay, I'm just going to save this really quick. I need to go in and introduce myself to my patient, orient her to your room, and get started for the day.
Amanda, I just wanted to let you know, your patient in room 8, I did a breathing treatment on her, and her lungs sound clear. Okay. But I'm going to do another one in a couple hours and see how it's going to go.
Okay, well, I haven't even been in there yet. I'm going to go check her out and talk to her and make sure everything's going okay.
Okay.
All right, thanks. Knock, knock. Mrs. Jones, hi.
Amanda.
Oh, Dr. Nelson, hi.
Yeah. Did you get the Banco levels for this patient?
No, I didn't see him in the chart, and
well,
I haven't had a
need
chance.
them right now, so can you go check them?
Yeah,
please?
I just got on shift. I'm just about to check on the patient to make sure she's doing okay, and I'll get them as soon as I can. Okay, thank you. Yeah, just go get it. Okay. Okay, got the Banco level. Dr. Nelson's on the unit. I'll give it to her as soon as she gets back, but I'm going to go finally talk to my patient.
Hi, are you the nurse? Can I talk to you out here for a minute?
Okay, sure.
It's my sister. I was just wondering, is there any possible way you can talk to the doctor for me? I think she's ready to come out of the vent. I really believe she's feeling better. I think she's trying to squeeze my hand. I think it's time, and I think you should lay down the pain medications and see what we can do. I think we're ready to take a step forward.
Okay, I haven't even met your sister yet. I'm trying to get in the room so I can go talk to her and just kind of see how she's doing. But as soon as I talk to her, and I can go talk to Dr. Nelson, and I'll let you know as soon as I can, okay?
Okay, thank you.
All right, thanks. Mrs. Jones, hi. My name's Amanda. I'm a nurse. I'm going to be taking care of you today.
Amanda?
Today is Sunday. Hold on, Mrs. Jones. Yes?
Have you gone to your other patient, room 7?
No, yeah, I just started my day. I finally got in this room to talk to my patient.
But they're ready for a CT scan. I need you to bring them down right now.
Do you think maybe you can help me out? I mean, I really got to stay in
Well,
here.
I'm busy with my own patients, so I'm sorry, but you need to go bring them down.
Okay, all right. I'll be back, Mrs. Jones. Okay.
In the ICU, the complexity of the patient's health status requires the nurse to interact with a large amount of people, including the patient, family members, doctor, respiratory therapist, dietitian, pharmacist, social worker, and physical therapist. Since each patient has a whole team working to improve their health, there is a high amount of traffic in the ICU. The amount of traffic may interfere with the nurse's perception that they have enough time to effectively communicate with the patient. Communication is negatively affected when the nurse is constantly being interrupted by other tasks to do, such as collaborating with other people who are also involved in the patient's care. While caring for patients, teamwork is essential, and sharing views on caring nursing practice is important in maintaining a supportive environment. For instance, maintaining staff morale and support for each other leads to better teamwork and more time for effective and sensitive care. Support from coworkers when caring for patients help encourage the nurse to take the time to effectively communicate with their unconscious patients. Patients in the ICU are continuously monitored with modern-day technology such as ventilator machines, chest tubes, and ICP monitors. Even though this medical equipment is needed to improve the prognosis of a patient, the nurse is more focused on the complex hospital technology rather than communication with the patient.
The ventilator. It won't stop going off. I don't understand.
The stupid feeding won't go down through the tube. It's a little too thick.
I wish someone would do something about all the alarms. I'm getting kind of worried. I wish someone would explain what's going on. Are they too busy for me? Do my nurses even care?
When technology adds more tasks and stress in the workplace, the nurse tends to view communication as a lower priority. Various alarms, unfamiliar equipment, and the constant procedures can cause distress in a patient and disturb the recovery process. The nurse should focus on both the patient's physical care and their psychosocial needs by finding a balance between technology and establishing therapeutic communication. If the nurse takes extra time to inform the patient about the purpose of the alarms, it ensures that the patient is involved in their own care. Not only will the patient be at ease, but it will also reduce any increased anxiety. Each barrier can be resolved using different solutions. For example, to help decrease misconceptions associated with attitude barriers, education continuation programs that specifically emphasize the importance of communication with unconscious patients could be implemented in the hospitals. One way to establish a caring and supportive work environment is to have areas in the nurses' stations set up where notes can be placed for coworkers saying thank you for helping on a specific occasion or just letting someone know you appreciate them. Since technology can sometimes get in the way of patient care, nurse educators and administration could implement an evaluation of nurses' ability to navigate the technology used in the ICU, so the focus can be more towards the patient and not on how to work a machine. Communication between the nurse and patient is extremely important in the hospital setting. Nurses in the intensive care unit should not let their attitude, environment, or technology get in the way of providing holistic care.